Hi guys, and today we'll be discussing about thyroid nodule. So patients who have a thyroid nodule, especially more than 1 centimeter, they should be evaluated for cancer. So if there's a more than 1 centimeter thyroid nodule, think about that this patient could have cancer. The worst case scenario is this patient could have cancer. First thing you want to do is ask questions about family history or the cancer risk factors, like if the person had a past radiation exposure or a cervical lymphadenopathy. Uh, Ask about compressive symptoms, like if there's a hoarseness in the voice or if there's a difficulty swallowing. Also, ask them about hypothyroid symptoms, like if there's excessive weight gain in some time, if there is lethargy, look at their skin, and also about hyperthyroid, um, if there is weight loss, if there's increase in appetite, and so on. And ask them if they're even euthyroid, so check their thyroid functional status, right? So ultrasound is the one thing that you want to do right away in these patients. You look for a thyroid nodule, do a clinical evaluation, ask history, do a general physical examination, do a physical examination of their thyroid, and then do a thyroid TSH level. So the thyroid stimulating hormone level is over here is important, and then you do a USG. Now, in if in a clinical evaluation and USG you think that this patient might have cancer risk factors, or if there's suspicious USG findings, then straight away go with the FNA. You don't need to worry about the TSH level. So if it's suspicious of cancer, do an FNA. On the other hand, if you think that there is no risk factor or there was nothing suspicious on ultrasound findings, then we are dependent upon the thyroid stimulating hormone. Then you would look at the TSH, and in a TSH, either you will get a normal or an increased TSH, or you will get a low TSH. Now, if you get a normal or an increased TSH, think that you have to get a FNA in this case. A good way to think about this is that maybe if it's normal, you're missing something. Maybe this might be cancer. Or if there's increased TSH, that why is the pituitary releasing increased thyroid stimulating hormone? Why is that happening? So do a FNA, and based on those findings, treat the patient. This is based on the findings. Now, if there is low TSH, then you want to find out that why is the TSH low. That means that the pituitary, the brain, knows that there is a thyroid nodule, and because of that the TSH is decreased. So that means that why has the thyroid nodule, it's probably independent of, it's working independent of thyroid stimulating hormone. In this patient, you want to do a iodine 123 scintigraphy. Or iodine uptake exam. Now we can get two things over here. We can either get a hot nodule or we can get a cold nodule. So a hot nodule or a cold nodule. If it's a hot nodule, then we treat it for hyperthyroid. And if it's a cold nodule, you go for FNA. So FNA, FNA, FNA. Don't forget FNA. Only if the patient has a low TSH and you do a iodine uptake and the patient has a hot nodule, only then you have found your diagnosis, that is hyperthyroid. In other cases, do an FNA. So this was thyroid nodule. Thank you very much.